With us today from Ambetter are Shondell Coleman and Tim Condon.
Thanks for everybody for joining for our Ambetter 2023 Open Enrollment Product Training. Normally we do our product trainings. They are geared towards a specific state. So we sent out invitations to everyone on this call to join a specific state training. But you know, I try to make this on more of a national view. So Ambetter was established in 2013. We're available in 28 states across the country. We are offered by the Centene Corporation in each individual state health plan. We're a Fortune, on the Fortune 500, we're a Fortune number 26 company with over actually 35 years in the managed care industry. We have 2 million plus members on the ACA. We're the #1 carrier in the marketplace, and we have been for the past 5 years in a row. Essentially, 1 in 7 ACA shoppers are an Ambetter customer. Ambetter is obviously certified as a qualified health plan issuer on the health insurance marketplace. And all of our plans are designed to deliver high quality, locally based healthcare to each member. So in every one of our states, we have a locally based health plan where our member services resides. So I'm trying to get this out of the way. Sorry, guys. We're going to try to just kind of talk about the big picture for 2023. As we all know, open enrollment ends on January 15th, 2023. Enhanced tax credits for American Rescue Plan Act continue throughout the entire year. Ambetter has a $0 copay for teledoc virtual urgent care visits, including mental and behavioral health on most plans. It's a $0 deductible for some plans, including the HSA plans. And introducing for 2023, CMS has required all carriers to come up with a CMS standardized plans so that all consumers can compare like plans together. As always, Ambetter is expanding. Ambetter virtual access has been added to 9 additional states. So we're going into Florida, Georgia, Indiana, Kansas, Missouri, North Carolina, Nebraska, New Hampshire, and Ohio is our states we're adding for virtual access. We're also entering into the state of Alabama for 2023. We've added 2 new states for our select products, Tennessee and Arizona. And then our off-exchange plans will be offered in the following states: Arizona, Florida, Georgia, Illinois, Indiana, Michigan, New Hampshire, Nevada, Ohio, Pennsylvania, Texas, Mississippi, Kansas, and Tennessee. And last but not least, Ambetter will be expanding into over 400 counties nationally for the 2023 open enrollment. Okay, so Ambetter plus brokers equals a strong partnership for growth. We pay competitive commissions on both our new and renewed members. We've been doing it since the beginning of ACA. We never stopped paying commissions. We never pulled out of anywhere. We also give all brokers a strong broker portal tool with customizable sales materials and trading tools inside the broker portal. And we have a dedicated broker sales and support team that works with you to deliver quick solutions to any issues you run across. We recognize that brokers are the lifeblood of our company, and we've done everything we can possibly do over the entire lifespan of our company to make sure that our partnership is extremely strong with all of our brokers. So this is just a visual representation of the states we are in for 2023 open enrollment. Again, all the dark raspberries are those states we've been in for over the past couple of years, and then Alabama is our new state for 2023. So our feature plans for 2023. New this year, Ambetter is renaming their products. I know we'll try not to make everybody's life difficult, but we're trying to make this as easy as possible for consumers when they go out in the marketplace to understand our products. So our bronze plans used to be all Essential Care 1, Essential Care 2, or Essential Care 5, or Essential Care 0, are now all renamed into Clear Bronze, Choice Bronze, HSA, Everyday Bronze, and Elite Bronze. Our silver products, all of our Balanced Care products, are now being renamed into Premier, or a variety of different names. So Balanced Care 4 is now going to be called the Premier Silver. Balanced Care 11, our largest product we have, is called Complete Silver. Balanced Care 12 is now our Everyday Silver. Balanced Care 28 is our Elite Silver. Balanced Care 30 is now our Clear Silver. And Balanced Care 32 is now our Focus Silver. Same with our Gold plans. Our Gold plans were Secure Cares 5 and 20. They're now Complete Gold and Everyday Gold are the new product names for these. So the idea behind this was trying to make it easier on consumers, direct consumers who were going out to the websites to understand. And then for our off-exchange plans, we're changing them from Balanced Care and Secure Care again to just Silver 201 HSA, Balanced Care 203 is going to become Silver 203. Our Secure Care 201 HSA is now our Gold 201 HSA. And then our Secure Care 202 is now our Gold 202. Okay, so our renewal members, most members will be informed that their plan has been renamed to a new Ambetter plan name. Plan coverage and benefits will remain exactly the same. New ID cards for 2023. Ambetter plans will be sent out in December like they always are. Some members will receive plan change letters if they've been automatically enrolled in a similar plan due to a consolidation or termination. So in other words, if somebody's in a plan that we're no longer offering for 2023, they'll be enrolled into the closest plan that we have. Renewal letters for exchange plans will not contain premium amounts. Renewal letters are required to be sent out as per CMS rules before the 31st of October. Some of the times the numbers change a little bit in terms of pricing. So rather than cause confusion, we're going to leave it up to you guys to talk to your members about what the renewals will be. And they can obviously you can go out and look at on our website as well to see what the prices are. So auto renewals members who want to stay on their plan have no life changes to report, no income changes to report. All they have to do is keep paying their monthly premium. Again, the renewal letters will be mailed out on October 28th. If a member has a life or income change, they can edit their member portal account by going to our website. So, as all marketplace plans have, Ambetter has the 10 essential benefits that everyone has to cover: ambulatory services, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental and substance use disorder services, including behavioral health treatments, prescription drugs, rehabilitative and rehabilitative services and devices, laboratory services and preventive and wellness services, and chronic disease management, and vision care for pediatrics. But in addition to those 10 essential benefits, all Ambetter plans come with our My Health Pays and Rewards program, our medical management programs, our $0 copays for virtual urgent care visits, including mental and behavioral health on most plans, $0 deductible on some of the HSA plans and other ones. There's no exclusions for any pre-existing staff. As we discussed earlier, we have a local health plan staff in every single state that we operate. To get into our plans directly, we have a core product, our bronze, our silver, and our gold plans. These feature Ambetter's broadest provider networks. You go into, when you go into looking for a provider, you just choose whether you choose a bronze, silver, or gold network when you're searching on the guide. These were formerly called Essential, Balanced, and Secure plans. They've now been renamed to bronze, silver, and gold plans in the first part. Members can visit any in-network provider, no referrals needed. Adult vision and adult dental buy-ups are available on most plans, and then it's available in all Ambetter counties. New this year, we have, or not new this year, we had some last year, but this year we're also featuring our select portfolios. These feature Ambetter's tailored provider networks. You go in, you choose Ambetter Select Network when searching for the Ambetter guide. It's lower monthly premiums than plans featuring Ambetter's broader provider network. Members can visit any in-network provider, no referrals needed. And the select portfolios don't have vision or dental buy-ups are offered. So we also are offering this year, we have started this last year as well, Ambetter Virtual Access Portfolio on a Babylon platform. Some of the in different states have different requirements regarding whether you need referral requirements. You need to look for each individual state to get that answer. Again, I'm trying to do this in a general man. Not every state is going to have select plans. Not every state is going to have virtual plans. You just need to pay attention to the specific states you're looking at. So we're more than happy to answer questions afterwards. Or again, we'll be having ongoing product trainings going on from October 6th through the 14th, and you guys are more than happy to go and see a state-specific product training, which will explain everything in detail. So on our Ambetter Virtual Access Portfolio, the plan is designed for members who desire virtual primary care experience. Members will download a Babylon app and select Babylon PCP. The plan is not designed for members who like traditional brick and mortar PCPs. Members on this plan should not expect to keep their current brick and mortar PCP. There's unlimited $0 visits with Babylon PCPs are included. Cost sharing will apply for visits with non-Babylon PCPs. Referrals are not required to see most providers outside their Babylon PCP, including specialists. There's a 24/7 virtual urgent care, which includes mental and behavioral health appointments at $0 cost to members. Members will have access to $0 lab testing at preferred labs. And then medications can be prescribed essential local pharmacy after a virtual visit. There's no vision or dental biopsy offered on the virtual plans. And then there's reciprocity to the core Ambetter network. Sorry, everyone, tough time talking to me. So just to kind of highlight our core benefit plans, again, we have the Gold plan, a Complete Gold, which is Secure Care 5, and Everyday Gold, which was our Secure Care 20, and Elite Gold. In the Silver products, we have a Complete Silver, which was a BC 11, our Everyday Silver, which was a BC 12, our Clear Silver, which was our BC 30, and our Focus Silver, which is our BC 32. And then the Bronze plans, we have a Clear Bronze, which used to be our EC1, a Choice Bronze HSA, which used to be our EC2 HSA plan, our Everyday Bronze, which used to be our AC5 plans, and then our Elite Bronze, which used to be our EC $0 cost plan. In addition to those, we also have what we discussed earlier, our CMS standard plans. Again, CMS standard gold, CMS standard silver. And there's a CMS standard bronze and a CMS standard bronze expanded. Again, these all feaure Ambetter's broadest provider network. We're introducing the new standardized plans that we discussed. All plans have vision and dental offerings, except for the standardized plans. Lowest premium bronze plans are our Clear Bronze plan. Lowest premium silver plans are our Clear Silver plans. Lowest premium gold plans are our Clear Gold plans. So hopefully make this easy for you guys. Lowest copay plan is our Focus Silver, and then our new plans are the Elite Gold with $0 deductible. Okay, so as we also discussed, we're also going to have some select plans. I pulled this one up. This is actually available in Nashville, Tennessee. Different states will have select plans. I didn't want to go through each state for you because we don't have enough time, but just to give you an idea so you get the sense of what a select plan entails. Here in Nashville, Ascension St. Thomas is a not-for-profit health system based in Nashville, Tennessee. It's a faith-based healthcare organization dedicated to delivering compassionate, personalized care to all, with special attention to persons living in poverty and those most vulnerable. So overall, our Ambetter is partnering with Ascension to offer our select product in Nashville for 2023. They can use any of the Ascension St. Thomas Hospital systems. There's over 541 acute beds and 40 critical cares, 80 special cares, and 140 telemetry beds. It's been named the #2 hospital in Tennessee. It's rated among the elite 12% of the hospitals nationwide to earn the best honors in U.S. News and World Report. Sorry, got a little excited there. And then over a 38-year history, they have raised over $100 million in support of St. Thomas hospitals and outpatient centers. So great hospital system. As you can imagine, if your client signed up for a plan like this, they can only attend and they can only use these hospital systems providers. Okay. Now we're going to get into some details of our plans. Here's our Clear Silver plan, formerly known, oops, sorry, again, getting excited. Formerly known as BC 30. We had the lowest premium of any silver plan we offer. Plan designs will be available on Clear Select Silver, matching deductible and max out of pocket. So these are the different categories based on income levels. This is obviously the lowest income level, so we'll just concentrate in this column. You can see the differences here. So on the Clear Silver plan, the deductible and max out of pockets match at $5,400 in the base, and then go down to $550 on the lowest income level. There's $0 co-insurance. There's no charge for any telehealth or virtual care unit. No charge for any telehealth or virtual care visits. The visits, specialist visits, labs, drugs, and preferred drugs, and urgent care and virtual urgent care are all 0% after deductible. Okay, so that's our Clear Silver plan. Our Focus Silver plan, which was formerly known as our Silver 32. This is our lowest cost silver plan that includes copays for PCPs, specialists, labs, urgent care, and generic RX. So again, we know the same. Every one of these screens are going to have the same kind of thing. This is the base numbers, and then here's our lowest income. So let us kind of compare. Again, here the deductible on the Focus Silver plan, the deductible is $6,100. The max out of pocket is $7,500. That goes down to $0 and $1,200 respectively. There is a 50% co-insurance at the base plan, down to 30% co-insurance at the lowest income level. There's no charge for telehealth or virtual care. PCP visits go from $45 down to $0. Specialist visits start at $100 and go down to $5. Labs start at $50 and go down to $0. Preferred generic and generic drugs are $5 and $25, down to $0 and $0 respectively. Preferred RX starts at $75 at the base plan and goes down to $20 for the low income folks. And our urgent care and virtual urgent care are $60 and $0 down to $10 and $0 respectively. Okay. Next up is our complete sliver, formerly known as our Balance Care 11. It's the lowest premium of any silver plan offered. It's got a $0 deductible at the 87 and 94 percentile income levels. So again, the base deductible and max out of pockets are $6,000 and $8,500 respectively, down to $0 and $1,700 in the lower income levels. Co-insurance starts at 40%, goes down to 25%. Again, no charge for telehealth or virtual care. PCP visits are $30 down to $0. Specialists are $60 down to $5. Labs are $30 down to $0. Preferred generic and generic RX are $5 and $20 respectively, down to $0 and $0. Preferred RX is $55 down to $25 respectively, and then urgent care and virtual urgent care start at $60 and $0 and go down to $10 and $0 respectively. Okay. Next up is our Clear Bronze plan, formerly known as our EC1. It's our lowest premium bronze plan. It's got a matching deductible and max out of pocket, and it features copays for generic medications and urgent cares. So again, the deductible and max out of pocket are both at $8,600, 0% co-insurance, 0% after deductible for PCP visits, no charge for telehealth or virtual care, 0% after deductible for specialists, 0% after labs. Preferred and generic drugs are $5 and $25 copays respectively. Preferred RX is a 0% after deductible, and then urgent care and virtual urgent care are $60 and $0 respectively. Okay, and then sorry, you guys couldn't cut off this. And then next up is I just want to kind of go through a Ambetter Virtual Access Silver Plan for 2023. Again, this is designed for members who would desire a virtual primary care experience. There's a $0 virtual PCP, specialist and urgent care, and then $0 in preferred labs. Same way, the base plan starts off at $5,700 down to $100 from the deductible. For the max out of pocket, it starts at $7,400 and goes down to $850 for the lowest income folks. There's a 50% co-insurance across the board. Again, no charge for telehealth or virtual care. PCP visits for virtual and then brick and mortar are $0 and $70 respectively, down to $0 and $20 respectively. For specialist visits for virtual, it's $0, and then brick and mortar folks, it's $100, and that all goes down to $0 and then $25 for the brick and mortar. Labs, preferred labs are virtual again $0, non-preferred $50, $0 all the way down to $0 and $0. Preferred generic and generic RX is $5 and $25 down to $0 and $0. Preferred RX is $75 down to $20, and then urgent care, virtual urgent care is $0. Brick and mortar urgent care is $70 down to from $0 and $20 in the lowest income. Hopefully this all makes sense to you guys. We're more happy to go into more details, and whatever you like. Okay. And then we also have sorry about that. We have an Ambetter Virtual Access Gold Plan designed for members, again, who want virtual primary care experience. $0 virtual PCP, specialist and urgent care, and $0 preferred labs. Deductible is only $950. Max out of pocket is $8,700. There's a 25% co-insurance, $0 telehealth and virtual care. Again, PCP is $0 and $55 for virtual and brick and mortar, $0 and $90 for virtual and brick and mortar, and $0 and $20 for labs, for the preferred and non-preferred labs. And then for drugs are $5 and $15, and preferred drugs are $50. Urgent care for virtual are $0 and $55 for the brick and mortar. Okay, these I just wanted to highlight. We'll just go through one of these plans again. The CMS standard silver, there's CMS standard silver, gold, and bronze plans. Every carrier has to have these. They have the exact same numbers. There's no change. The only difference is going to be the actual selling price in a particular county. So these will all be the same no matter which carrier you use. Again, the base plans, deductible and max out of pocket are $5,800 and $8,900 respectively, down to a $0 deductible for the low income folks, and then a $1,700 max out of pocket. PCP visits start at $40 for the base plan, and then go down to $0 for our low income folks. Specialist visits are at $80 down to $10. Labs start at 40% after deductible, down to 25% after deductible. Preferred generic and generic drugs are 20 and 20 down to 0 and 0. Preferred RX is 40 down to 15, and then urgent care and virtual urgent care are 60 down to 0. Okay. All right. For the standard plans and our core benefit plans, they have the ability to add adult vision and dental. Adult vision is for members that are 19 years of age and older. What it includes is routine. You basically get essentially a free routine eye exam every year, and then you can either get eyeglasses or contacts that are covered up to $130 with the plan. And then for the adult dental add-on, again, 19 years of age or older, there is no, for this, there's a benefit maximum of $1,000 per covered person. Routine dental stuff, oral exams, cleanings, x-rays are $0 copays. Basic dental, minor restorative stuff, and then major dental, major restorative stuff are all charged at a 50% co-insurance. Most importantly, there's no waiting periods whatsoever for any of these services. You can immediately, as soon as you sign up for a plan, can immediately start taking advantage of the dental and vision plans. Okay. All right. We also this year are offering off exchange plans. Off exchange plans are ideal for consumers who don't qualify for subsidies. These are affordable premiums compared to our on-exchange plans. It's the same provider network and formulary system as our regular core benefit plan. You enroll through our EDE tool powered by Health Sherpa at enroll.ambetterhealth.com. You can also go into your broker portal, and there's a link there that says enroll now. Just click on the link, and it'll bring you right to the enrollment tool. Our off-exchange plans are going to be available in Arizona, Florida, Georgia, Illinois, Indiana, Kansas, Michigan, Mississippi, New Hampshire, Nevada, Ohio, Pennsylvania, Tennessee, and Texas. We have our silver and gold plans. Again, like we discussed, there's a silver 201 HSA, a silver 203, a gold 201 HSA, and a gold 202. Okay. So the features of some plans include obviously low deductibles, primary care and specialist copays, and then copays for generic and preferred medications. And then many of the plans have an optional adult vision, adult dental bias as well. So I'm going to kind of switch it over to let Chandel take over from here. He's going to kind of tell you about some of the coolest programs we have and why you guys should be selling Ambetter. Chandel, take her away. Chandel? Okay, well, hopefully you guys can still hear me. I'm just going to kind of continue. Okay, so what we're going to kind of cover is just our final provider formulary, our My Health Pays, and our telehealth. So if you go out to our website, a member can go just click on and create a member login, which creates his own member portal. All he has to do is put in a username and an email address, and then he can go into he creates a portal, and then he can log right in. This is on our website at www.ambetterhealth.com. You just go there. There's a tab that says members. You click on it, and then there's a thing that says log into your portal. Okay,
hey,
so once, yep.
Hey, sorry about that, man. I was literally saying hello. I was already in. Did you want me to finish it here? Because I'm good. I can.
Yeah. Take over from here. Okay. So we're just
perfect.
talking about the member.
Awesome.
So go ahead.
Yeah, awesome. So here, this is the member portal. You'll see at the top it shows all the different categories, which we'll get to in a bit. So you can see how the member portal is laid out. Got the doctors, pharmacies, payments, rewards, activity, and usage, as well as the coverage on the member portal. So make sure every member of yours, sign up, because it's very beneficial for them to look up their PCP, anything about their claims, ID cards, and et cetera. But it's a good tool for them to use and keep track of everything. You can go ahead, Tim.
As we're seeing here, here's the Ambetter guide. To start, you can get it from the portal. Go ahead, Chandel.
Yep. Can you click on that to move forward?
Yep. So again, I don't know if you guys are seeing this, but again, all you're doing is you're being asked, do you have a plan? What county you're in, and then here you're being asked if you want to select. You can select your network. Is it a select network, a value network, an Ambetter virtual access network, or just a bronze, silver, and gold core plan? Oh, you guys see this? Okay, good. Go ahead, Chandel.
All right. Are you able to move forward from the screen, Tim?
Oh, apparently my.
I can pull it up for you. I got the slides too if you want. It's no problem if you want me to.
And I'm going to stop sharing it.
Okay, cool. There you go. Perfect. All right. See it here.
Guys, in the meantime, I'll look at the questions and see if there's anything I can answer real quick.
Yeah, that'd be helpful there.
Okay.
All right, so Tim already went over that for you all to the portal here. Hope everybody can see that on the screen. So I want everybody to make sure they remember this. This is the link that you go to find a provider. It's guide.ambetterhealth.com. This is where you go to check out to see what networks are in network with us, as well as they may not be out of network with us. So make sure you keep that in handy. Here, once you click on that, it's going to take you to our provider guide site. If you have an account, you can either log in. If you don't have an account, that's fine too. You just go ahead and click on don't have a plan. It's going to give you the same accurate results. If you don't have a plan here, you're going to go ahead and select the state. We're just going to use Florida, for example. You go ahead and select the coverage here as well as the county. And then this is very important too. In some of our states, we do have different networks based on the plan itself. So either your members in a select or value or virtual access or bronze, silver, gold. This is just Florida, for example. So, every state is different of ours. So make sure you select the right network to get the best accurate results. There might be a member that might have a select networks of certain networks that you can go to. And then you may have another, member that just have virtual access. So just keep track of that. Here's the whole homepage of our provider guide. It'll let you know the state, year, what kind of provider network plan it is. You can pretty much edit there to put most of the information you need to know on the plan. Either you're looking for a PCP, or you're looking for a certain doctor name, or you're looking for a certain category. We have that all here for you. All right. So here it will show you, once you select the provider, give you information on the doctor's name, the address of theirs or where they work, let you know they're accepting any new patients, if they're in network, and if that provider also offers any virtual visits. If you do click on view a provider, it's going to give you additional information behind that. It also lets you know the NPI number, which is also good for you to know in case you need to find out if a provider is in network or not. And so here, this is just an example here. Again, this is the Ambetter value plan. So here you just put you got this provider, city and state. It lets you know if it's going to get a referral. So it'll let you know right away. And in that case, you'll know what you need to do. As you can see on your right. Back here at the home page, if you go to the For Members tab, and you go ahead and click on drug coverage. So I'll let you know where you could find that at. We do have, I saw some of the states do have the 2023 up already. So you can, go up there and start looking at that if you want. But you'll click on 223, preferred drug list. It's going to take you to a big file here. But the best way to do this lookup is Control F. So make sure you hit Control F to input the medication there to look up that drug. If it's not popping up, most likely it's not covered. But we do have some exceptions, or maybe you can find something that's more of a generic drug. That might be the same to look up there for the medications. Here's here at the member portal. Let you all know that your members, about the pharmacies. They can click on pharmacies. In case a member, want to know what pharmacy they can go to, check out to see what the drug coverage or drug price lookup is going to be. So they do have that option on their member portal. Here, they click that. It'll show you different ways your member can make a payment. We got different kind of ways. Your member can make a payment. They can either go to the Ambetter site.com, which is ambetterhealth.com. Actually, that's they can go ahead and do that. Pay now. All they have to do is just input some of this information here, which is their policy number, their date of birth, and their zip code. Please be advised that the policy is not active until the first month's premium is received. Okay, very important, and that's pretty much how you all are going to get compensated as well. So make sure you keep track of your business and your enrollments. The different ways your member can make a payment. We got various ways as far as they can make a payment by phone, they can make a payment by mail, or they can do a payment by MoneyGram. There are also some payment settings if your member want to do an auto pay setup, if they want to manage their wallet, enroll in any paperless billing, or download any invoices or past invoices that they want to look at. Now, the broker won't have access to the member portal. You know, they can, as long as you have the login for your members. Usually they have to create an account on there. So for the post application, just to be advised that after the enrollment, the members can expect a pre-member letter. It's just going to remind them to make their payment. Once that payment is received, your member will receive an ID card and a welcome packet in about 7 days. Just so you know, just for returning members that's already a member of ours, they can just sign into their member portal and go ahead and complete any surveys or any activities. Any new members that you bring on board, you know, make sure to create an account on their member portal so they can get access to all those activities there. All right. So I'm going to talk to you about the rewards. This is a very hot topic that I like to talk about. We offer members what we call My Health Pay rewards. We'll get into that as we go on. But My Health Pay is a program that we give our members. It's a way for them to earn rewards just for completing any and different various healthy activities. They can watch some videos, read some articles, complete some different health challenges, and they can use that money to pay, you know, any bills of theirs, like monthly bills and et cetera. But I'll go into that in a bit. So My Health Pays here. I'm going to say this a couple of times, but yep.
And I'll go in 1 second.
Yep.
Go backwards. Keep going. Take it back to the gym thing.
Okay, I got you.
Keep going. More. Okay, so this screen just kind of highlights that your members can use. You don't go forward one screen. Sorry. This screen that we're trying to show you is membership has a right stop right there. They have, you know, they can earn healthy activities, but they also can get stuff to go into like gym memberships and a few other things. So now we'll go into the, you know, go ahead and do My Health Pays.
Thank you, Tim. So yeah, My Health Pays is a program that we offer to our members. You can earn up to $500. You heard me right. That's $500. That's free money that your members can just take time out of their day to complete some surveys. We have some different activities. They can earn points based on those activities. So they can, you know, it's very easy. You know, it's easy money. So, you know, if there's a price disadvantage in maybe an area or so, and we're, you know, $30 disadvantage, hey, there you go, My Health Pays. You're earning all this free money to use. So, you know, we get older. As we get older, we want to take care of our body. So different screenings, different diabetes screenings that your member can do in surveys, and all this adds up into points and then free money for them, right? So this is a good way for them to focus on eating right, being healthy, as we all should be. And those points they use those points to shop on online reward store. And they get this nice raspberry card here at the bottom, so they can convert those points into dollars so they can pay some you know, any health care related costs. And we'll get into that in the next slide here. So some of those healthcare related costs include monthly premium payments, doctor copays, deductibles, co-insurance, and not just that, right? You got monthly bills. We all do. So you can use that also for utilities. You got any transportation, education, and rent. So I think this is, you should be talking to your members every time about this, any prospect, because I know I like free money. Me and Tim, you know, we used it ourselves, and it was an easy step to just do some activities and get some free money, you know? So I think that's a really good thing about Ambetter. This is just a more breakdown of what that looks like. So, you know, we have the onboarding, we have the wellness, we have the screenings, the activities. So, you know, you can keep track of this in the members portal. They can see what activities they need to do. They can see what points that are worth, and they can see based on those points, what value they can get out of that. And again, this is up to $500. So that's just free money out there that's just doing different activities. And you do get a deadline. So, you know, members want to make sure they complete that deadline so they can, you know, get the best get the best bang for their buck, right? And they're paying all that money for their insurance as it is. So My Health Pays, this is a very, very nice of us because nearly 300,000 Ambetter members have activated their My Health Pays accounts. 300,000, right? So that's a big number. We're very happy about that. And, My Health Pay members have collectively earned over $24 million in rewards, right? So that's a lot of money. Members activate their My Health Pays more likely to renew because, they like the program, Tim did mention about the gym and the membership. Affinity is one of those programs that we do offer where members can get discount on different services through Affinity, as far as doing different gym, different classes, memberships, ED services. So if you need to know more information on this, you can let us know. We can pass that information along to you and what the members can look up, for more information on that. All right, move past here. All right, so we're back here at the member portal. This is Telehealth. This is one of our virtual access programs that we offer to our members. Teledoc, some of you all may know Teledoc, very popular for members. So with Teledoc, if you're new to this, it is a 24-hour help for non-emergency issues. We connect some of our top experts regardless of where members live. It's a good way to avoid those long wait times, at the offices, help reduce those costs of healthcare, and it's good for those rural areas. And good to know too, this is a $0 copay for virtual urgent care visits. That also includes the mental and behavioral health, but there is a $0 after deductible for some of our plans, including the HSA plans. So make sure this is given to your members. Again, this is all free stuff for them, and a benefit that they get out of just being a member on our plan. Disease management. This is just another program, a free program that we offer for our members to help them keep track of their health and wellness. Make sure their members are aware of this. This is a free program for them to keep track of their health, anything related to diabetes and such. Just let them know, hey, this is here for you. And if you have some of those members that are experiencing, health conditions, hey, this is here for you, So we are very proud of all the programs that we offer for members. And again, with disease management, just help them keep track of their health, right? So either, their diabetes, blood sugar, blood pressure and everything, and any alerts and reminders that you might get from clinicals. So I think this is a great tool that we offer members, and anything related to not only just diabetes, but pregnancy too, and a lot of different other things. And if you need more information on that, you can definitely let us know as well. So here is the broker portal. This is where all of our agents keep track of their book of business. This is the link, broker.ambetterhealth.com. Okay, you have to be an appointed broker to make sure you have access to this. There at the bottom, I'll get to that later on, but that's our broker sales support line in case you just have any issues logging into your portal and such. So here's the whole main screen of the portal. You got it really nice for you all. So here, just to show you all some of this, we have a tab here that says Enroll a Client Now. We do give agents the option to internally enroll clients. So rather than going to Marketplace or maybe your own personal account with Health Sherpa, you hit Enroll Client, and you can simply do that. Find a Provider is also there for you, and Quick Pay. If you all the one-stop shop. You got your total active members, delinquencies, and your unpaid binder payments as well, color-coded. And if you go ahead and click on View Total Active Members, these are the members that's up to date, on their payments, all these members. So it looks pretty much like this. You got your broker name, NPN, policy information. You got the receive date, the effective date, members information, a little bit of that. And then here at the top right, this is where you can download your whole book of business to Excel spreadsheet. I recommend brokers to do this. I know you all may have some back office, but you also can use this to, just keep track of your business for those who might have fell off of Medicare or such. It's a good tool to use. So click on policy. You're going to get more information on the members. You'll be able to order any ID card form. You'll see the receive date. You'll see what the APTC is. See their invoices. So you get a lot of information, good information on the members here. See what plan that they're on. You can also order ID cards, for your member. So rather than just going somewhere else, you can simply go in your portal and just order an ID card. Please be advised that Once you do, it will be mailed within 7 to 10 business days, not days, but business days. Okay. All right, so here you got the delinquent policies, those members that may have be behind on their payments, either 30 days, 60 days, 90-day delinquents. We do offer that for you, so you can keep track of that. Paid due date, that's very important. That's where you can see what members are behind, and you need to reach out to them to make sure they're up to date. Their member responsibility, and you go back here on policy there. And then there, the delinquent status, show you how far along that member is as far as their payment. Only time we do term a member is due to non-payment. So after 120 days, we go by terming that member, that policy. Right. Well, there's just other information there. All right, perfect. So just another way to make a payment, you can just input the policy number, last name, zip code. It's going to pull up the member, and they'll be able to make that payment there. All right, paid due date. If you don't see a paid due date, that just pretty much means those members haven't made a payment, right? So everybody want to get paid for their hard work. Make sure you keep track of this, or your back office, however you do, because that's how you're going to get paid and compensated. All right, let's go ahead to resources. This is a good tab too in your broker portal that we offer. We got different things as far as marketing materials for you. We got some training materials for you, and there's also some forms, some FAQ questions. If you got some, any events you all are doing and you need like some Ambetter goodies or Ambetter swag, I like to call it, make sure you reach out to us, reach out to your sales rep. In reference to, about getting some of that. It is free of charge, but it is based off on, your event and what you got going on. So you do have all those tools available for you in your portal. And I think this, compared to other carriers might do, this is pretty neat for you all. A good neat thing here is your profile. If you go to profile, keep track of all your applications that you contract with us. You'll see at the bottom, you'll see if you're either the principal or the sub-producer. You'll see what states that you are contracted in, what's your status on that application. And if there's any issues, give us a call, our broker support team a call, let us know, so we can make sure you're appointed in time before open enrollment. So you will see your licensing. You'll see where you are pretty much in the process of getting appointed with Ambetter. So I'm going to the top reasons to sell Ambetter in 2023.
Yeah.
This is just a yep.
Let me interrupt you for just a second. Again, sorry guys. There's top reasons to sell Ambetter in every specific state. We have specific reasons, but I try to make this kind of nationally. The network on the right-hand side, that's just for the state of Tennessee. We obviously have networks in every single state, and we're just trying to highlight some of the hospitals a little bit. So there'll be one for each particular state if you guys get a chance to go and see those product trainings. But top reasons why you want to sell Ambetter. We're Centene ranked number 26 on the Fortune 500 list. And why that's important to you is that we're a very financially stable company that's been growing year after year after year, and we're not going anywhere. So great company to work with. Ambetter is the number one carrier in the country for the past 5 years in a row. Ambetter covers 1 in 7 lives nationally, so we have over 2 million members. We've had products in some states since the beginning of ACA. In Tennessee, we entered Tennessee in 2019. We have our enhanced teledoc program with a $0 copay. We have enhanced My Health Pay system, which again, as Shondell pointed out, each member can earn up to $500 annually, which can reduce your monthly premiums by over $41 per month. We have our value-added benefits with all the different programs that we added, including our Smart Start for your babies, our health management programs, our 24/7 nurse advice lines, and our care management programs. We give you guys the tools you need to be successful in your enhanced broker portal. We have a dedicated broker support team that's here to serve you guys, and Shondell's going to talk about that on the next slide. We have an enhanced director enrollment tool that we provide for you guys for free. And then we can always try to add on providers if you guys have a specific provider that you really think would be a strong addition to our team. So go ahead, Shondell, I'll let you do the next one. And this is our contact information.
Yep. So there's our contact information. As I told you on our left side is our broker sales support. So they're there to help you with these different categories from member inquiry, commissions, web support tool. If you need assistance finding a provider, any contracting issues, you can follow with that number, 855-700-7985, option 2. And their email is there as well for you, ambetterbrokers@centene.com. And also, we do pretty much the same thing with broker sales. If you can't get through the broker sales support for any reason, just know we're there on our sales side. We help with appointing any agency or agents looking to contract, giving you education about our commission and bonus programs, any trainings. We do have different trainings going on within this month, any marketing requests, and, a strategy for open enrollment for you. So we can be reached at the same number, 855-700-7985, option 3. And our email is ambettersales@ambetterhealth.com. Make sure you have that in handy for you. There you go. Okay. Yep. So there's information there. We got Tim Condon, our regional sales manager, his contact information, and then our sales reps below. So you got Anton Range, you got Kobe Banks, you got Patrick Tanner, and you have myself, Shondell Coleman, on the Midwest region. So any questions you all may have, issues, give us a call. Whoever your sales rep is, find out who that is. Just know we're here for you, in case you got any questions or issues. And, we want to make sure that you are successful as well as, Ambetter continuing on. And then there's the ambetterhealth.com, just the main website for you all. The member services number do vary. You can go to ambetterhealth.com, and then you can also get, the direct number for member services for that particular state at the bottom of that site.
Okay. Well, thanks, Shondell. That kind of handles our presentation. We do have some questions. I'd like to kind of go through these real quick and try to answer them. Steve and everybody, I appreciate you guys giving us the time, and I'll try to be mindful, and you just cut me off when we need to be cut off. Okay, so how do you find your sales rep? Your sales rep is Shondell Coleman. You can reach him at 619-30, what's your number again? 3087.
Yeah, 312-619, yep, 3087, yep.
And his email address is shondell.d.coleman@centene.com. Commissions are not, we don't announce commissions, unfortunately, until usually the last week right before October. It's like a candy, it's like a gigantic poker game with all the carriers. Nobody wants to show their cards. So usually all of our commissions and bonuses come out literally the last week right before open enrollment. So last week of October. Okay, is there still a limit to number of Ambetter plans that you must sell as a broker? There is no production requirements whatsoever. Sell 1 or sell 200, it's all good with us. There's no production requirements. You guys can get appointed in any state you want to get appointed with to sell our products. There's no production requirements. Okay, let's see. I don't know what that was about, but we'll keep going on. What is the broker number again? The broker number again to reach our brokers are 855-700-7985. Extension 2 will get you to the broker sales support team. Extension number 3 will get you to the broker sales team live. Okay, these phones are manned Monday through Friday during normal business hours. In open enrollment, they're manned Monday through Friday, 8 a.m. to 6 p.m. and then Saturdays from 8 a.m. to 12 p.m. Okay. The session today sort of follows tomorrow's all the sessions that are going on from starting tomorrow all the way through the 14th of October are very state specific and have more detail than this one did in terms of state specific information. There are no stipulations for the reward program. So long as you are a member of Ambetter, you have an opportunity to take advantage of this reward program. As Shondell said, myself and him were used as guinea pigs. It took us about 2 weeks to get to 500 points or $500. So very easy to do. If paid first premium is late, is planned retroactive. Again, you had 30 days to make your binder payment on our plans. The subsidized folks have 90 days grace period on that. So as long as they make it within that time, they're okay. Have you fixed the member payments in the broker portal? Ambetter said it's not accurate, so we can't go by that. Yes, Becky, that's been fixed for a while. That should be fairly accurate. They're putting enhancements into the broker portal right now, so there might be a little glitch in the next couple of days, but other than that, it's normally been pretty good for the last few months, so you should be good. Can you repeat the member portal address again? It is, if you just go to our website at www.ambetterhealth.com, You click on that, that's our website. There's a tab up at the top that says members. You just click on that and it'll bring you right to the portal, member portal. Moves for families are different on each different plan. Robert, you got to look at a specific plan. There's no one set one. We can't say anything. Chat's turned off. Sorry, chat's back on. Ambetter does have plans that has uses telehealth as we described. Preferred and non-preferred is in and out of network, or again, preferred and non-preferred means drugs is what we're normally referring to, and then there's an in or out of network referring to specific providers. There is virtual urgent care. Brick and mortar means if a person does not want to have a virtual doctor, they want to go to a physical location to go see their doctor. That's what we mean by brick and mortar. Non-preferred labs are non-preferred labs are labs that are not in a network. Is preferred RX brand name drugs. I'm not sure what the question is there, Mark, if you want to ask again. Mark, you said you have provider share. You'll have to be more specific. We operate in, again, 28 states. We have lots of good providers in lots of good states, so I'm not sure what your specific issue might have been, but more than happy to answer that question for you. They don't talk about other carriers, so don't really know. And then Mark, on our provider tool, we try to keep it as accurate as possible. We update it frequently. Unfortunately, sometimes providers leave our network in midstream, mid sentence. We just had one leave. We had 3 new hospitals and had one leave in the Kansas City area in the last 30 days. So we try to update our website as much as possible. If there is a mistake, we are more than happy to try to help you out. If you ever can't find someone, if anybody has any problems or issues finding a provider, just let us know. We're more than happy to try to help you out. Okay? We have plenty of providers in lots of different states and lots of different areas. So, okay, that kind of seems to answer most of the questions. Again, thanks everybody for your time. We look forward to having a great open enrollment season. Thank you, Steve, for your time and letting us to present to our team.
Thank you, Steve.
If anybody has questions whatsoever, please contact Shondell or myself.
Thank you so much, Tim and Shondell. I really do appreciate all your time. This has been very, very informative. I'm impressed with all the things you guys are offering, especially the rewards program. I think our customers are going to love that. Just a reminder, we will send out a link to everybody for every session, so you'll be able to access this recording for future reference. It'll probably take us a few days to get all that organized, but we will get those out for you. Thanks, guys.